Stuart Smith. My usual role is Director of Transformation for Islington within North Central London Clinical Commissioning Group. However, during COVID, I've instead spent most of my time supporting the primary care response in North Central London. This has meant that together with my team, I've been supporting primary care on issues such as how it and our 111 services collectively respond to supporting the increased demand, especially at the early stages of the pandemic, appropriate PPE and making sure there's access to supplies of it, new ways of working through primary care, such as remote monitoring via pulse oximetry, the rollout of different types of testing in primary care, including for staff, and at different stages of the pandemic, the interface between primary care and acute-based services has both sought to respond to the crisis. The response to COVID has reminded me about the importance of tenacity as a leadership behaviour. Whether rolling out testing to primary care or seeking to enable our local primary care system to have a reliable supply chain for PPE, we've had to take a test and learn approach. Sometimes things worked, sometimes things didn't, and when they didn't, we had to work to try something new. The COVID response has also reminded me of the importance of working relationships with partners across the system. I've always believed in the health and care system that effective leaders are those that have strong relationships with people across multiple agencies, and this experience has really confirmed that to me. And I think working at home from a distance has made that even more clear. I feel like the time I invested in relationships with key colleagues from acute trust, primary care, other CCGs, local authorities, trying to gain understanding has really paid off, because we're able to trust each other and each other's perspectives, where we're coming from as we seek to tackle quite immediate issues. And most importantly, COVID's reminded me about the importance of teamwork. You shouldn't try as a leader and do everything yourself. It doesn't work. You need a strong team around you. And I'm really proud of the role people within my team have taken, whether it's building a demand model for PPE in primary care, or being on the phone to help people navigate and feel reassured about the staff testing system. I've really seen my team rise to the challenge, with many of them taking on new and different functions. And in addition to this, the value of those 15 to 20 minute informal catch-ups around bits they're working on with the team that's delivering them. Just to check in and hear about their successes or things they're passionate about trying to make work. So when you feel you might be too busy or have too much on your list, you need to remind yourself as a leader that we succeed within healthcare as teams. Our clinical leads' passion for issues and their determination to find answers for patients has impressed and inspired me throughout the COVID response. I don't work in a frontline role, but the work me and my team do really affects frontline services. So it's really important I stay close to what's happening within them and listen lots. When they're able to bring the patient's stories, it really brings both reality home and aids in the building of consensus around issues with others who need to work together to find resolution. Whether it be finding answers to providing testing for patients attending primary care COVID services, or making sure the primary care voice is strong in conversations about the response or our recovery, I've admired that and taken great energy from the work of our clinical leads. During the COVID response, we've been able to achieve things within days or weeks that usually would have taken months or even years in ordinary times. So I'm going to try my best to hang on to these experiences and help others see that everything's possible through shared ambition and teamwork.